Can we get some more chairs? Is it okay if we grab some chairs across the way from people?
There's a few seats up front here too.
Yeah, Mommy's there.
Cindy, you're coming.
All right, so I think we're going to go ahead and get started. This workshop, or whatever you want to call it, is increasing access to social security benefits for veterans. And the presenter we have here, Kristen Johnson, she is a social security facilitator supervisor for DSHS in Region 1, which is like the eastern Washington area of Washington. So, and then she has Kristen Lepore on the screen here. She's also going to be co-presenting with her. If you need a stamp at the end, just come up here and see me, and I will stamp it with you.
Okay. Thanks, Darla. I'm really honored to be joining all of you this afternoon to talk about, or this afternoon, oh my goodness, it is so morning there, very early morning. I am on the East Coast, so I'm like getting close to my afternoon. All right, so really excited to be talking to you about increasing access to Social Security disability benefits for veterans. So real quick disclaimer, the views, opinions, and content expressed in this presentation don't necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Human Services. So with you in person, if you've already met, is Darla Johnson, who's the co-Soar State Team Lead and the Region 1 SSI Facilitation Supervisor. Myself, I'm Kristen Lupfer. I use she, her pronouns. I'm the project director of the SAMHSA Soar TA Center at Policy Research Associates. So our purpose and objectives for today are really to share the importance of supplemental security income, or SSI, and Social Security Disability Insurance, SSDI, benefits for individuals who are experiencing or at risk of homelessness, including the income, health insurance, education and employment supports, and housing stability that comes from those benefits. And we want to offer opportunities for veteran service providers to get involved with SOAR, which includes connecting to local SOAR efforts, the SOAR online course, and the SOAR online application tracking program. So I imagine that some of you are familiar with the SOAR program. We're also welcoming some of you who are going to be new to SOAR completely. So I'll start from the beginning for kind of a quick review. So SOAR stands for SSI, SSDI, Outreach, Access, and Recovery. SOAR is a SAMHSA-sponsored program, you could guess from the disclaimer, that focuses on increasing access to Social Security disability benefits for individuals who are experiencing a risk of homelessness, who also have a serious mental illness, medical condition, or co-occurring substance use disorder. SOAR is for adults and children. It's active in all 50 states and Washington, D.C., but each state's really at a different level of implementation. SOAR for children is still really getting established and expanding in communities. And we see VA, homeless programs and grantees and other veteran service providers as really great opportunities for SOAR integration. So Social Security benefits and programs are really complex. There is a lot to learn, and so I'm just going to give you a taste so we're all on the same page and I leave you wanting just a little bit more. So people often confuse the two types of disability benefits offered by the Social Security Administration. All of the acronyms sound the same, but SSI and SSDI are separate disability benefits with significant differences, but some similarities. And we really see these benefits as a tool and a means of helping stabilize someone's life. So we'll start with SSI. SSI is available for adults and children with disabilities. The SSI benefit rate for 2022 is $841 a month, and it changes annually with the cost of living increases. SSI is based on need. So the non-medical information required for the application is pretty detailed to determine someone's current income and resources. And then to determine eligibility, SSA also needs to have a complete picture of not only their income, but their living arrangement, their assets. Those limitations on resources, for an individual it's $2,000, for a couple it's $3,000, and Medicaid is the associated health insurance program with SSI. SSDI is for adults only, and the monthly amount is based on earnings history, which means it's different for every individual. So you know those pesky FICA payments that come out of your check every couple of weeks? Those are your insurance payments if you became disabled. The good news for SSDI is that personal resources and living arrangements do not affect one's benefit amount. SSDI eligibility uses the date of onset of disability, which is determined by the Disability Determination Services, and it's tied to when the individual stopped earning at a substantial gainful level because of their disability. And then eligibility begins 5 months after that date of onset, so there's a waiting period. And Medicare is usually provided after 2 years of eligibility for benefits. So SSI and Medicaid, SSDI and Medicare. SSI is needs-based, and SSDI is an insurance benefit for those who have worked and paid into the system, or some family members. But we won't get into those weeds right now. All right, so it's really important to note that the definition of disability for SSA is different from the VA's definition of disability. So SSA is looking at the individual's inability to engage in what they call substantial gainful activity, or SGA, which is calculated at $1,350 a month this year. So the disability also must be by reason of a medically determinable, meaning there have to be medical records, physical or mental impairment, which can be expected to either result in death or has lasted or can be expected to last for a continuous period of not less than 12 months, which is a really long way to say it's for long-term disabilities. It is not for a short-term disability that someone will recover from, but rather something that will last at least a year. There also does not need to be any service connection for veteran eligibility. All right, so why is this so important? Why did you gather at 8 a.m. This morning to talk about disability benefits? So we know that to ensure the ongoing support and stability, we want to do everything we can to maximize income for veterans and their families. And we know that SSA disability benefits can really help to provide access to both income and health insurance to veterans who are unable to work at that substantial gainful level. So veterans with disabilities can receive SSI or SSDI in conjunction with or as an alternative to VA disability benefits. And the Medicaid that comes with SSI and Medicare that comes with SSDI can be a really important supplement to VHA coverage. So there's a real opportunity for staff that are serving veterans to help with both SSA and VA benefit applications. And for veterans with disabilities, SSI and SSDI can increase income and housing stability, reduce their future risk of homelessness. So like I mentioned, veterans may be eligible to receive both SSA and VA disability benefits, but there's even more to income maximization. We want to look at every combination of income sources to support veterans and their families in establishing and maintaining housing stability. So income from employment can be really key, even for veterans with disabilities. We want to promote and reassure that employment is possible and encouraged while applying for and receiving disability benefits. We can get into that more in a little bit. So the goal is really to build a foundation for wellness, recovery, and resiliency. And so we have to start with really strong bricks of steady income. We also know that we need that employment, education, and health insurance to provide stabilizing bricks in that foundation. So income is just the beginning, and income maximization builds that strongest foundation. And with that foundation brings access to healthcare and housing, increased access to treatment support services, which leads to ultimately a decrease in incarcerations, institutionalization, and hospitalizations. All right, so what makes SOAR unique? Why are we talking about SOAR in this context of, the importance of disability benefits? So SOAR isn't easy. It's not just writing, SOAR at the top of an Ssi or Ssdi application. Submitting high quality and complete Social Security disability applications is really hard work, and we see SOAR trained caseworkers as the heroes of that work. But we do this hard work because we know that it works. So we have studied our outcomes, and we know that the use of the critical components of the SOAR model to fidelity means that applications are significantly more likely to be approved, so statistically more likely to be approved. And they do that through using the SSA 1696 appointment of representative form to keep in contact with SSA and DDS through the application process. They're collecting and submitting medical records, writing a medical summary report in support of the claim, documenting functional information about how the individual's illnesses and conditions are impacting their ability to work. They're getting that co-signed by an acceptable medical source or treating physician. They're doing quality review of that application and then tracking those outcomes. So we know that by providing this comprehensive support using these critical components, that a SOAR-assisted application is more likely to get approved. So we know this by carefully tracking outcomes. It's through community collaboration, it's partnerships with the Social Security Administration and disability determination services with medical providers. SOAR-trained caseworkers have been able to successfully assist over 50,000 people to get approved for benefits on their initial application. For unassisted applications from people experiencing homelessness, the average approval rate on initial applications is only about 10 to 15%. The national average for all applicants isn't much higher, only about 30.8%. So most people are denied on their initial application, right? However, the cumulative national SOAR approval rate is over double that at 65%. SOAR decisions last year were made in 155 days. These days to decision have been up a little bit because of COVID, but this is no more waiting 1 to 2 years for an appeal. SOAR is really about getting it right the first time. What I can tell you also, a little sneak peek into our 2022 outcomes. We've just concluded our outcome reporting period. We're getting ready to calculate those numbers, and it looks like our national approval rate has gone up to close to 70%. So we've seen a really exciting increase in that nationally. So for our, in addition to, the impact that it makes on each individual application and getting those benefits quickly for those individuals who are eligible, we're also making an impact in our communities and the agencies within which we work and the communities that we're located. So in addition to the approval for benefits, our states and communities that provide a general assistance payment, we've seen an average of almost, $2,895 per approved application reimbursement in general assistance back to states. We see an average of Medicaid reimbursement per beneficiary of $38,000. So that means that our Medicaid providers who were previously providing uncompensated care, not getting paid for care that they were providing, are now getting reimbursed for that care once the individual is eligible for Medicaid. And those numbers are astounding per beneficiary. The average retroactive back payment is over $6,000. And what we know from calculating the income that's coming in now for individuals and into their communities, for all of the individuals who've been assisted by SOAR, it's over $564 million a year. So it makes a huge difference, this work, in making sure people have the income they need. All right, so if you thought those national numbers were impressive, 65% cumulatively average across the country, you should check out the outcomes from our top 10 states. So these states have a cumulative approval rate of 79% on over 22,000 decisions. And what we know is that these states are achieving higher approval rates because they're following fidelity to the SOAR model and they're using the SOAR critical components. So it's implementation of those critical components that's increasing the likelihood of approval for eligible applicants, like I was saying before. So it's those SOAR trained providers that are actively assisting with applications, collecting medical records, writing the medical summary report, which, like I was saying, is a narrative that's documenting the individual's disability, and they're ensuring that those applications are high quality and fully complete. All right, so we're going to switch gears to talk about SOAR in Washington for a minute. So we have co-state team leads in Washington. So you met Darla this morning. We also have Wanda Johns, who couldn't join us today, and a number of local leads around the state. And so you can find their contact information in the directory on the SOARworks website, which is linked here. There we go. All right, so now that we've kind of established some of the basics, we're going to shift gears to talk about the roles for service providers in the SOAR initiative and the VA and SOAR resources that are available to support that work. So the outcomes that I mentioned earlier don't come easy, but service providers really can help in the process. You can help to connect the veteran to healthcare. You can help to arrange for mental health and medical evaluations. That'll go a really long way in ensuring that veterans have updated medical evidence. You can help to gather medical records and support the application. And documenting disability is one of the most important parts of the application process. We have to be able to show to the disability examiner that the veteran meets the listings or level of impairment required. So your documentation of the veteran's symptoms and limitations in daily activities, social interactions, and concentration can really support the application. I think I lost a slide in here. But one other thing I kind of wanted to point out about income maximization is that while we are exploring all potential income sources with the veterans, along with their eligibility criteria. We may not be providing the assistance directly, but helping to connect the veteran with disability application assistance and employment supports can be really important. And we encourage service providers to use the VA income and benefits calculator to kind of start these discussions about income maximization. And I'll talk about that tool in a little bit. So we encourage, connecting veterans to a benefits planner to help kind of figure out and navigate, how working and VA benefits and SSA benefits can all kind of work together. The good news is you don't have to be an expert in all of these regulations. Those experts are out there. So you can access, SSA work incentive experts on the SSA Ticket to Work webpage that's up here on the screen. You can also access VA benefits experts in VSOs and regional benefits offices as well. Right. Let me skip this one. I'm going to go back to that slide in a little bit. So the VA released a memo from the Assistant Undersecretary for Health for Clinical Services and the Chief Medical Officer in February 2022. And the point of this memo was to further clarify that in support of applications made through SOAR, Veterans Affairs employees may act as an advocate, sign application documents, and act as the veteran's authorized representative. So ultimately, the memo notes that SSI and SSDI benefits can help to end homelessness among veterans, and that VHA personnel working in homeless programs can assist by becoming trained in SOAR and using the model to help veterans through the application process. And we have a link to this memo on our website. And the reason that we bring it up is we want to kind of illustrate that across the board, from VA grantees, VA staff, other non-VA funded, veteran service organizations, that there is widespread support of using the SOAR model to assist veterans with their disability applications. And this is just one more kind of piece of evidence and illustration of that widespread support. So in addition to that support from leadership about SOAR, the VA Homeless Programs Office also helped to support the development of what we call a SOAR integration toolkit, and it was to help the SSVF programs, or supportive services for veterans and their families, to integrate SOAR into their work. But I mentioned the toolkit today because it is useful to programs beyond SSVF grantees. It covers Ssi and Ssdi eligibility criteria, SSA work incentives, combining income streams, collaborating with other community programs, connecting with SOAR state and local leads. So it's really a SOAR integration toolkit that's applicable to all kinds of providers. But it also has, special things specifically for SSVF. But like I said, again, is broadly applicable and available for anyone to kind of use as a guidance toolkit there. All right, so I mentioned the VA income and benefits calculator, and so you can see here a screenshot of that calculator. It's designed in Excel, Microsoft Excel, and it's to help encourage individuals to utilize SSA work incentives to maximize their income. So it has separate calculators for both SSI and SSDI beneficiaries, and it provides a visual and calculated representation of how increasing income from employment or other benefits will affect overall income. And what we find ultimately is that work pays, right? Work can help bring up total income. So even if, for instance, the SSI benefit goes down, because of work incentives and other things that Social Security has in place, total income will go up with the combination of earnings from work and the resulting SSI payment. And so this calculator kind of helps to show that, so that a veteran could put in, if I'm getting, $300 in VA benefits, my gross monthly wages are $500, I'm putting away this amount of money for my past plan, and my SSI benefit was this amount. Here's what I'm going to get total overall when we put all of this information into the calculator, and it's a really great kind of planning tool for that. All right, so I've talked about a lot of information and all of these critical components of SOAR, and you're like, well, how are we supposed to figure out how to do this? Well, we have a SOAR online course. We actually offer 2 SOAR online courses. We have an adult curriculum and child curriculum. So one that focuses on SSI and SSDI applications for adults, and one that focuses on SSI applications for children. Both courses are online, they are free and available to take anytime and anywhere. We estimate that it takes 20 hours to complete each course, including the practice case component, which I'll talk about in a minute. That successful completion comes with 20 free CEUs from the National Association of Social Workers. And we have SOAR leaders in our communities and in Washington to help coordinate follow-up training and support for individuals who are working on and who complete the course. So not only is the SOAR online course full of really valuable information about eligibility and the process and how you can do a complete quality application, but it really gives you the opportunity to put your newly learned skills into action. And so you are introduced to a fictional applicant, and you get video interviews and medical records and progress notes to learn about the individual. And then you take that information that you learn and you complete 5 Social Security forms and a medical summary report in support of that application. So a complete SOAR-assisted SSI and SSDI application packet. You submit that completed packet to us at the SOAR TA Center. We have a team of expert reviewers who go through every single form, every single question you've answered, your medical summary report, and provide detailed feedback about what you did really well, what could use improvement, so that you know in the future when you're assisting on a real application, what needs to be included and what you need to maybe review, or what you've really learned. And so you can show to yourself that you've really been able to apply the information that you learned in the course. And so this practice case component of online learning was really kind of a novel thing in the kind of online space of public health education. And we're really excited and proud to be able to kind of offer that level of implementation in the course. All right, so getting involved, the time commitment. You're like, this really sounds like a lot of work. This lady's talking about like 20 hours of an online course. And people ask, what does it take to really be involved with Soar? So yes, it takes approximately 20 hours to complete the course. You can do that. It doesn't have to be all in one sitting, all in one week. You can do it, over the course of a month, where you take a couple of classes each week, work your way through it. But we then estimate that based on both kind of anecdotal evidence and information that gets reported in our outcome tracking system, that it takes about 20 to 40 hours to complete each application. Actually, the average number of hours that get tracked and out is approximately 20 each year to complete the application. That is from start to finish. So that is from the first outreach visit that you have with someone who might be experiencing homelessness to getting that hopefully approval letter in the mail. So it is all of those interviews, it's all of those interactions, all of that engagement, all of that communication back and forth with SSA and DDS. And that 20 hours is spread out over, oftentimes 60 to 90 days, right? So it's the time period taking to complete all of the application, get it submitted, get it decided. So we know it takes a lot of time to do it right. We could do it in a shorter amount of time, but we're less likely to get the application approved, right? And what's the point of investing time if we don't think we're going to be successful? So we want to be successful, so we got to put in that time, which means that we need to have dedicated staff time to both learning and then implementing the model. And that requires planning and supervisor commitment, right? So we have a resource on our website that outlines, the importance of implementing the fidelity model, tracking those outcomes, because it's really worth that time investment. The benefit to the individuals you serve is first and foremost, and then, like I said, it also brings Medicaid reimbursement, funding opportunities, mission fulfillment to our agencies, and getting it right the first time and serving someone who has income and health insurance is so much easier than serving someone who has no income, no access to treatment or care, and helping people kind of achieve those ultimate goals of wellness and recovery and resilience. All right. So I'm trying to not scare you away. I'm going to tell you why this is worth the effort. All right, so the SOAR process and the Washington SOAR process, it's a collaborative effort between SOAR providers, the Social Security Administration, and the Disability Determination Services to establish procedures and expectations for the processing of Ssi and Ssdi applications that are submitted by SOAR providers. So in Washington, we have a contact at the state level DDS office. We have contacts in each of the SSA field offices, and those contacts are contained in this document that's available on the SOAR website. It also contains the contact information for your local DSHS contacts, including Darla, and walk through the steps of submitting a SOAR-assisted and complete application in Washington. So I'm going to talk just briefly about tracking outcomes because it is absolutely essential to the successful implementation and expansion of SOAR. So we provide, through SAMHSA, support a free web-based database to track SOAR outcomes. We call it OAT, Online Application Tracking. It's very user-friendly. It's on a secure server. It's HIPAA compliant. Registration is super easy. We have multiple user roles that help with agency, local, and state leads who want to facilitate, reporting and report reviews for, individuals that work within their purview. So it's kind of a comprehensive system to help monitor quality and show the effectiveness of the program. This is just a screenshot of our caseworker dashboard, which helps to keep application outcomes organized, really allows for easy reporting. It only takes 3 to 5 minutes to add the outcomes for each application, so it is really not a time burden to the caseworker. We ask, very limited number of questions, again, all de-identified, so we're not collecting any of that personal information, just so that we can see the outcomes of applications and the effectiveness, like I said. All right, so I already mentioned that good high SOAR outcomes don't come easy. It requires that time and effort to submit quality and complete applications. But the good news is that we here at the SAMHSA SOAR TA Center, we provide some free support to states and communities to implement SOAR. So we have liaisons who are responsible for SOAR in multiple states, who build relationships locally to really provide a personalized service. And I am that liaison to the state of Washington. We provide assistance from strategic planning at the state level, developing funding plans, building key collaborations with federal partners, like Social Security, DDS, and the VA, or DDS is the state agency. We help caseworkers with question 25 on the SSI application. Really, if it has something to do with Social Security disability applications, we want to help make that process smoother, more timely, and at a higher quality. We offer SOAR over lunch calls for new and seasoned caseworkers to get their questions answered. We celebrate success stories in our monthly newsletter. We train local and state leaders in a leadership academy. And then we have just a library packed full of tools and resources on the SOAR website for stakeholders at all levels. And actually, if you go to our library and you filter by population focus and veterans, you'll see all of the resources that we have available for veterans. So everything that I kind of mentioned on the slides today, we have online in the library on the SOAR website. All right, so what's next? I definitely encourage you to check out that website. That's where you'll find the resources that I've mentioned and ways to get started. So our kind of tools and information about getting started are here at Starting Your SOAR Initiative. The SOAR online course catalog is available with access to both the adult and child curriculum. We've got our SOAR and Veterans Topics page, which takes you to all of our resources for serving veterans, and then our SOAR TA Center liaison directory contact information is here, so you can look me up there, Kristen Lupfer. I'm on there. You can email or call me anytime. And so that takes us to the end of the presentation, and I know that we have just a ton of time left for questions, and I would love to, hear from all of you. I wish I could see you, but hear from you about what questions you have, both about, Social Security disability access for veterans, how to get involved with SOAR, what in the world I was talking about earlier, whatever it is that might be coming up, and Darla is going to help facilitate those questions. And maybe, Darla, before that, if you had anything else that you wanted to add about just SOAR in Washington, I think that would be great.
Yeah, so we are trying to increase it, especially here in Eastern Washington. There's a pretty good SOAR initiative going on in Spokane, or at least there was. It kind of fell apart during COVID. We're trying to get it restarted. We have just started some funding. Wanda Johns, my co-part, she has some funding where she funded 10 positions. And so there is one in Yakima, and then most of the rest of them are up the I-5 corridor. So we're just trying to increase that. We're also trying to reach out to a lot of our tribal partners, trying to get people involved to help in their local communities. So, that's our goal, is to try and get it out there, try to help. We also try to collaborate with DSHS, because we do have SSI facilitators, and our clientele are very similar. And usually, so it's like if we collaborate together, we're working together to help them. So that's kind of why I got involved in SOAR, was to kind of bridge that gap, and so that we are collaborating together to help. It's kind of exciting right now. Things are starting to happen a little bit more, and COVID was hard on all of us. So we're hoping we get things back on track. So.
A question, Darla. With just a 15% initial success rate on average, what are the most common problems or mistakes you see in first applications?
usually when somebody does it themselves, you know, if they don't have anybody to help them and they just go and apply and, you know, they don't have any of that system, they have somebody to kind of help to tell the story, to gather the medical. That's another big issue, and especially with our people who are homeless, or they may not be seeing providers, they may not be building that medical case, because we have to have the medical evidence. So that can be a big start. So maybe you are in contact with somebody and you're just starting with them. Maybe before you do the application, let's get you going and make sure you're going to see your provider to help build that evidence-based case. No, Kristen.
Yeah, thanks. That's a great question. So, you know, for people experiencing homelessness, of course, the obvious reasons of, you know, when they're applying on their own, not having a mailing address, phone number for follow-up, you know, SSA is communicating primarily by mail. So they're missing those requests for information, requests to go to a consultative exam or an appointment, you know, with one of Social Security's contracted providers when there isn't enough medical evidence, like Darla was saying. So I think some of that Social Security calls it failure to cooperate, which just means that you haven't followed through fully with the process like they've asked you to. That happens a lot for people experiencing homelessness applying on their own. But like Darla was saying, the lack of medical evidence is the other big thing. And I would say, in particular, the lack of functional information. So something that we dig into in the Soar online course is Social Security disability eligibility and the SSA listings. And SSA has, you know, a definition or a listing of impairments for each, you know, body system and symptom category. And so, for instance, if we're looking at mental impairments, they have listings for schizophrenia and other paranoid disorders. And they're looking at, you know, different symptoms that someone might have related to that illness. But then they're looking at the areas of mental functioning, and that's half of the definition. So the first part is just those symptoms. Okay, so you've got like check. We see in the medical records, we're seeing with observation, you know, the symptoms this person has, this mental illness. But then they say, okay, is that illness impacting their ability to work? Is it impacting their functioning? Because many of us live with a mental illness. Many of us are in treatment and doing well and functioning well, and we are working, we're earning at an SGA level. We're not experiencing disability right now. But some of us with mental illness aren't, right? And we are struggling with our functioning across many different areas of our life. And that's what Social Security wants to see and needs to see. And that is not typically in our medical records, right? And so that half of the disability definition and requirement is missing. And so that is really one of the things that we see as, you know, really key part of why the Soar model is effective, is that our trained caseworkers are documenting that disability. They are asking questions about functioning. They're writing that up in the medical summary report, and they're making that connection between the symptoms and the functional impairment. And it's just something that, you know, our doctors and providers are not able to do with the, you know, 15 minutes that they get with somebody. They're really just, you know, top level, you know, documenting symptoms, and not how that, you know, symptom of depression really manifests itself in my activities of daily living, and how I'm functioning in the community, and how my social functioning is struggling, right? And so that's the piece that the Soar trained case worker can add. And so I think, so to go back to that initial question, I think so many people are denied because the disability examiner doesn't have that level of severity. They can't see it in the medical records, and they say, yes, you have a diagnosis of depression, but can't tell whether or not that's actually keeping you from working. And so then they get denied. What other question?
So, just real quick, when an initial application is denied, what is the process for appeal after that, and how many times can somebody appeal a denial?
So I don't know if you heard that, Kristen. Yeah.
I did.
Okay. Do you want to take that?
Sure. Well, I can start, and then Darla, please add. So there is an appeals process, a fairly generous appeals process that Social Security offers. And so the first level of appeal is called a reconsideration, and it goes back to the DDS office. It goes back to a different examiner, different medical reviewer, and you had the opportunity to submit additional evidence and say, you know, oh, this was missed, or you didn't see this treatment provider, or I'm here now, and I have this information. You know, it's basically an opportunity to say, can you reconsider that decision? We think that you made a mistake, and here's why. And so they do that. So that's all still at the same kind of level. It's similar to that initial application because it's all happening within the DDS. But then if you're denied a reconsideration, the next level of appeal is called a request for an administrative law judge hearing. And that gets a little bit more complicated. So it is we call it an ALJ. The ALJ hearing, that level of appeal, it takes quite a lot longer for that to happen. There have historically been, they're working hard to get through their backlogs, but you know, historically that can take a year or more to get your ALJ hearing scheduled. Typically people will have either an attorney or a trained representative, someone who knows how the process works at a hearing, help them through that ALJ hearing. So we have some SOAR trained providers who assist with ALJ hearings. It's another level. We have resources on our website about, you know, how that works. Many SOAR providers will help with the reconsideration level because it operates in a similar way to the initial application. The ALJ hearing is another kind of level of training kind of required for that assistance. If you're denied at the ALJ hearing, you can go to the Appeals Council, which is another level of review. Less people go that far. You do have to have an attorney for the most part at the Appeals Council level. But people can, you know, apply as many times as they want. There's no limitation on the number of times. So if, you know, they're denied at the Appeals Council, they want to do another new application, they can submit a new application. There's no barring that. So, you know, people have, you know, gone through many times, you know, of applying and getting denied, applying again, getting denied. I'm sure that you all have heard, like, anecdotally, those sorts of stories. And it's not just because, you know, some of those people are ineligible. They're just never going to be approved because for whatever reason it is that they're getting denied. But we see that there are a lot of people, and especially a lot of people experiencing homelessness, who were denied for years, but it was because of all of those things we talked about just a little bit before. They just didn't either follow through or have the evidence there or have someone to help them make the connection to show how their symptoms were, you know, impacting their functioning, you know, to this degree. So I hope that was really long-winded, but I can also put a link in the chat to our appeals resources, or, you know, if you go on the SOAR website and put appeals in the library, we've got really great resources and an appeals toolkit on kind of what to do and how to navigate that.
And I'll just add to that too, with the Appeals Council, they can either approve it, they can flat out deny it, or they can remand it back for another hearing. So I've had seen people who've gone through, like, you know, multiple hearings and back to the Appeals Council. If it gets finally denied at the Appeals Council, they can also, and that level, SOAR doesn't deal with, DSHS doesn't deal with, but their attorney can actually file the federal district court. And at that point in time, they can file a new SSI application as well. But federal district court will then decide whether or not to send it back to hearing as well. So it can literally go for a long time. Hopefully, the goal of SOAR is that we want to give them that perfect application, the package all wrapped up with neat little bow and say, here it is, please approve it. So that they don't have to go through that process.
Yeah. One thing that I'll add about the benefit to appeals, real quick while we're on the topic, is that if someone is approved upon appeal, they receive back payments to their initial filing date, so their initial protected filing date. So there's a huge benefit to the applicant to maintain through the appeals process rather than just filing a new application, because then, you know, unfortunately, if it takes that long, if a year later they do get approved, they get a year's worth of back benefits. But if they didn't appeal and just did a new application, they wouldn't get those kind of protected benefits. So just a kind of note about that, why appealing is a benefit.
Yeah, what if somebody gets a new disabling condition? Do they have to start a new application? application, or they could just add it on?
It depends on at what level they're at. So if at the initial, the recon hearing, they added in. If it's there at like the appeals council level, the appeals council would have to give them permission to say, and I've had this happen with somebody who had a mental health condition that was filed, and then they were diagnosed with cancer. So the appeals council then allowed them to file a new application on cancer, so they didn't have to wait for that.
Did they end up still getting for that?
Yeah. Once they get approved, so, yeah, and then, yes.
Yeah, Adrian Wall, Spokane County Veteran Services. As I understand it, for VA non-service connected pension, SSI is not considered an income.
Did you hear that, Kristen?
I couldn't hear the question, no.
So he was asking if,
For VA non-service connected pension, is SSI considered an income?
so for VA non-connected pension, is SSI considered
An income.
an income, sorry?
That's okay.
It is considered income, yes. So for those low-income veterans who are receiving, needs-based pension, because SSI is also needs-based, they will bump up against each other in terms of other unearned income and impacting the benefit of both, right? So if you are, over amount receiving VA pension, you could be ineligible for SSI if your other income is too high. So they will look at it as what they call unearned income, and it dollar for dollar knocks off your SSI benefit.
Right, okay.
That's a good question.
I've heard different things about that.
Yeah, and again, it depends on if it's, you're talking about SSI or SSDI, they have very
Yes.
different roles on income.
Very. Right. So, and the different types of VA disability benefits. So we have some resources on the SOAR website that helps to explain each one. So each type of VA disability and each type of SSA disability and how they knock on each other. So some of them you can receive in tandem, and some of them will knock each other out. So when you're looking at the needs-based benefits, they can knock each other out. But if you're looking at the insurance-based benefits or the service-connected benefits, they won't. And so if someone is receiving a service-connected disability from the VA and is also insured for SSDI, they can receive both and they won't impact each other. So they can just stack on top of each other. So there's, it's kind of can be a puzzle piece based on which, benefits the veteran is eligible for. And that's why it's so important to explore all of it. Because sometimes you can stack them, and that's really kind of a wonderful thing for kind of what we call maximizing income, like trying to get as much income support as possible.
Thank you.
Yeah.
So does a VA disability rating, the higher rating, help get the SSDI?
Yes, it does. She was asking if the VA disability rating, a higher rating helps with
So in that, you likely have more evidence, right? But just because they're eligible for VA benefits doesn't necessarily mean that they'll be found eligible for SSA benefits, right? Because the VA is looking at a more narrow scope and definition of what the veteran is still able to do. And Social Security is saying, is there something else the veteran could do? So they have, a bigger look at it. What they will do for a veteran who has 100% permanent and total disability, they'll expedite their claim, but their claim won't be automatically approved. They'll probably be approved, right? But not automatically. It'll get expedited because they think probably, right? But we're going to still put our, look at it. We're still going to place our eligibility definition on those medical records and see if we agree they meet our Social Security definition. So it helps in that the veteran likely has evidence showing, that 50% disability, that 80% disability, that 100% disability. It'll help because they have the evidence, but it doesn't, translate exactly, if that makes sense, to they will certainly be approved.
Any other questions?
I'm learning something new. I really like a concrete example, and I realized I'm one. If it would be helpful for you, I can tell you in a minute or two about my own process going through both of those. And I'm willing to talk about the amounts of money I get as well. So I'm Dave Sturgill, and I'm the director of the Kittitas County Veterans Coalition. In my late 40s, I served 16 and a half years on active duty, so I probably have total working military and civilian of 25 years. In my late 40s, I applied for VA disability, and I was rated 100% total disability, permanent. And then a year or two later, my wife filled out the SSDI application, and fortunately she's smart, and it was approved. It took about 8 months. My highest military rank was an E6, so that gives you an idea of what kind of money I was making. My Social Security disability started about age 48, and it was, today I think it would be around $1,600. One of the things that Kristen has already mentioned is that after 2 years you do transition into Medicare, whether you want to or not. And so that takes about $200 out of my Social Security disability. So currently my Social Security disability payment that I see cash to me is about $1,353. So for a guy that worked, military and civilian, 22 years, paid into that system, that's the insurance that comes back to me based on my lifetime earnings. Like I said, it took about 8 months, and it was backdated to the time of the original thing. So I woke up one morning and there was $11,000 in my bank account, which is always nice. As 100% VA disability, that's about $3,500 for me right now, and then that $1,350 SSDI, so that's enough to live on, and we were even able to buy a house. I'm just curious if any of you have any questions or what our experts think. Am I typical or not typical? I suspect I'm not typical, and that my wife was smart enough to get the thing applied, but I'm curious about the application time and everything else. This all happened maybe VA disability 6 years ago, SSDI 5 years ago, so. Thank you.
Were you approved at the initial, or did you have to file an appeal, or?
No, it was approved at the initial. It was almost a complete surprise to me. My wife did mention something about, I'm applying for you for SSDI, and then a doctor called to talk to me, and I wasn't there, and he talked to her, and then the next thing we knew, there's the money. So that sounds almost like I'm a unicorn. You better not take me as the good example. But I hope an idea of those income levels and those timelines will help. I really love the Soar program, and we're trying to get our county VSOs to do it. So thank you guys so much.
Thank you. Thank you for sharing.
Are there any other SOAR representatives? Are there any other SOAR representatives in this room?
I don't know. Is there any other SOAR representatives? Anybody SOAR training?
I'm in SOAR training.
You're going through the training?
Yeah, so it's just taking me long, because I'm also doing benefits, so I was learning both the benefits, and I'm trying to do some training at the same time.
It's a lot of different.
Yes, and it's very different.
A lot of paperwork.
Yeah. So I'm like, I kind of put SOAR a little bit.
And what area are you in?
Actually from Portland. Yeah, so I work in THB, the Transitional Housing Program.
Well,
All right.
we'll go from Christine.
I actually did have one question though. So, one of my clients, he did his initial claim on his own for SSI, and he did the paperwork himself, and the medical record was not his medical record. Is it better to just get your medical records and turn in with the application? Because all of his medical records go through the VA, and the VA is extremely slow with everything. So, is it better just to have it, or do the release?
Well, and
So I can do this.
yeah, it's just, and Kristen may be able to answer that better than I remember. Because I think there is a thing with, Social Security and the VA where they can get those records, directly from the VA.
Yeah.
A little bit faster than trying to get them, because I know VA records are really slow.
Yeah, the VA is usually slow.
Because their records are not.
Like the VA will refer people out to certain well, you just forgot the password. So I didn't know if it was easier to get the record yourself.
Did you get that?
Yeah, I think so. So I think it's two things, and I'll talk, specifically and then more broadly. So yeah, Darla's right that SSA and the VA, they have a really great partnership for medical records, and for the most part, SSA it's really the DDS, the state-operated DDS that works in kind of contracting relationship with Social Security to do that disability determination. They can get VA records if they're standard pretty quickly. One of the things that we say with the Soar model is the importance of getting medical records directly as the Soar representative and the applicant, together in partnership for a couple of different reasons. Sometimes, if it's non-VA records or even VA records, if they're non-traditional, knowing what you've got and what's in there. And so one of the things that we're doing when we write the medical summary report is we're connecting what's in those medical records, what those diagnoses are, what those symptoms are, with the functional impairments that we're observing and that the individual is reporting. And if you don't have the records, you can't do that. And you don't know what's missing. So you might think that your records have the information you need. You might think that the VA will report on X, Y, Z, and that will be in your record. But what if it's not? And so that's one reason why we recommend, and as part of our training, is collect those records. Yes, DDS is going to get records on their own too. They're required by law to do it. You are required with the application to sign that SSA 27 for DDS to request those records. So that's going to happen anyway. But the SOAR trained representative and the applicant themselves going through that process of getting the records, seeing them, and then helping provide them to DDS is really important and valuable, both for writing the medical summary report, and then also sometimes we're able to get records that DDS isn't, because one of the things like we talk about with SOAR is we can go into that medical records department and we can bring cookies or flowers and say, hey, this is what I'm doing. I am serving veterans who are experiencing homelessness, and we just really need these records for their application. And I so appreciate the work that you are doing. You are amazing and such a key part of, what is going on for individuals. And to show, people who, like, sometimes medical records departments, they're in, like, basements of hospitals and just unappreciated or feeling unappreciated, and we can show our appreciation and get those records. And so that's, like, one of the strategies that we talk about with records collection. With DDS, when they're requesting records, they're sending out a fax that's just showing up, and the records department is either going to respond to it or not. They don't always respond. And so that's why we take this really proactive approach to getting records, because we know that, it's voluntary. Like, DDS sends out the request, it's just a request. They offer payment, which is nice. So some records departments, they'll reply because either they think, it's their job, and also, the records department will get paid. But if they don't reply, nothing happens. They're not punished. There's no recourse. So then DDS will send another fax, and they'll wait. And if they don't get the records, they don't get the records. And so a SOAR provider can use, we call it a gracious persistence, which is just being really, kind and but persistent in requesting those records, and by building relationships and knowing that Sarah in the records department at General Hospital is the one who will reply to my phone calls, and she'll pick up my fax, and she will get me the records quickly. It's that sort of thing. And so it's about how can we make our systems work better for those veterans that we're helping with their applications. And so, part of SOAR isn't just knowing how to do a good application application, which is really important, but it's also like building those systems collaborations. It's who are those medical records providers we need to know, who's my contact at the SSA field office, who's my contact at DDS, who do I need to talk to at the VA to make sure that this individual is getting the treatment that they need, they've got updated records, whatever that is, and kind of working together as a system to make sure that these applications do get through quickly and approved that first time.
I'll just add another tip. If you have any clients who are on the Age Blind and Disabled program, if you list DSHS as a source of records, you don't need to get the records from us because DDS is part of DSHS. They can just look into our files and get whatever they want out of our files. And they do that all the time. They don't even ask us. But no, it's very helpful because we do evaluations for the state program as well. So, and we collect medical records. So a lot of times we'll have a lot of information.
Is there like a list of SOAR qualified providers that we might be able to refer veterans to within our own communities? Because normally I just have to call around to like disability resource centers, DSHS, community health workers.
It's kind of hard because we have a lot of people who have gone through the training, but that doesn't necessarily mean that they are actively doing it. We do have those SOAR leads in certain areas. There are some, like Clark County right now is just like, they're amazing. There's so much going on in Clark County. I could definitely refer you to somebody there. It depends on the area. And yeah, but you can always reach out to us and we can see if there's somebody in the area that is doing it. But that's why we're also encouraging more people to get the training so that you guys can provide those services too.
So would it be best to reach out to one of you guys, the leads?
Yeah.
Okay.
You can, and again, you go onto the SOAR website, you go somewhere in your state, and then you click on it, there's my information, there's Kristen's and Wanda's information, as well as the local SOAR leads for the That's always Yes.
So I am a SOAR representative. I've gone through the training and whatnot, but I do have a question. So there's so much mystery, we'll say, surrounding SOAR when it comes to the SSVF program and other case managers and whatnot you interact with. I get a lot of people who ask me, hey, can you do a SOAR application for a non-homeless veteran so we can increase the family's income? And to my understanding, the SOAR program is for our homeless veterans who need help applying for Social Security. Is this something that I should be doing? Because I feel like I'm getting requests to do that all the time rather than helping my homeless veterans. So I'm just curious.
Yeah, so Chris, what she's asking is, she's getting requests for veterans that aren't homeless or housed and for help, and whether or not through SOAR she can help them, or is it just for homeless veterans, or whether
Also family members.
And family members.
Can you do my wife? Can you do the kids?
Yeah, excellent question. So SOAR is for individuals who are experiencing or at risk of homelessness. So that at-risk piece of the definition is very broad. So it includes individuals who were experiencing homelessness and are now in a Housing First program, who got assistance through an SSVF provider and they're in housing, but perhaps that housing is being paid for with a voucher or paid through a subsidy from another program. And if that veteran does not have income and has a disability, they're at risk of losing that housing, right? Because if the voucher ends or that subsidy ends or that support ends, they'll be experiencing homelessness. And so even if someone is in, permanent supportive housing or Housing First or that sort of situation, if they don't have income and have a disability, they're at risk of homelessness, so would count for our definition. So it is very broad and inclusive. I would say if you have an individual who, or veteran or their family, and they are just stably housed, they're good to go, they've got support, they're not at risk of losing their housing, but they still need to apply for disability benefits because they could be eligible. You can use the model, you can use the information that you've learned to do a good application for them. You just wouldn't mark it as SOAR, so it wouldn't get flagged as a homeless claim or SOAR claim, in Social Security system, and you wouldn't track the outcome in OAT as a SOAR assisted claim, because we don't track those outcomes for those stably housed individuals. But what we say, to people is that, the SOAR online course, it's free, it's open to the public. Like, anybody who wants to know how to do a good Social Security claim, this, you can go there and get that information, and you can use it for anybody. Our efforts are, focused on those vulnerable individuals who are experiencing our risk of homelessness, but, the information is out there, if that makes sense. So, if it's going to get flagged and marked as SOAR and tracked as SOAR, we want it to fit, that definition of those vulnerable individuals we're focusing on. Otherwise, just do a good application for someone. We have, I'll give an example. Members of the SOAR TA Center, I didn't say this in my opening, I'm a trained social worker. I used to do homeless outreach. I implemented SOAR, 15 years ago before joining the TA Center and doing this nationally. So, I have experience doing Social Security applications. I've helped a family member do their Social Security application, right? I didn't count it as a SOAR application, even though I used all of my SOAR knowledge, but kind of get how that goes. So.
Got it. Thank you.
Any other questions?
I also get a lot of clients too that tell me they don't want SOAR assistance. So I don't know how your clients get with that, but just the other day, actually, I had a client that I was working with. I contacted him, hey, I'm ready to collect your medical records. Can you please provide me your medical providers or anybody that you've seen? And I had an hour-long conversation with this gentleman who was telling me, I don't trust your organization, Capital Community Services, SSVF, with my medical records. I don't trust this, I don't trust that. And I'm going to try and work with them, of course, a little bit more. But just for when you work with your clients who are especially unstable, I'm pretty sure schizophrenic in a way, work with them and build some rapport and trust with them, with their clients, because I feel like that's really what interfered with my ability to help him. So I wasn't a direct case manager, just a SOAR case manager, and so that really kind of infringes. He's over 100% disabled with the VA. He doesn't work, he can't work, he has no income, he's homeless, but he does not absolutely want any kind of assistance from me. And that kind of made me sad because I want to help him. But just a thought, like it's a great idea, but it's not easy.
No, and that is very hard. I think especially a lot of times with veterans, they don't trust, and especially being associated with the VA. And I've dealt with that as well. I mean, you could try, is he getting any DSHS benefits? Is he on ABD or anything like that? That might be a way to go. See if he would be more willing, because it's not, we're still the government, but we're state government, not federal government. Sometimes that helps. Yeah, and that's a hard one, because if they're not willing to get the help, receive the help, it really does come to, sometimes you just kind of have to back off and let them know, I'm here when you want to. You could also say I can help to connect you to Social Security directly if you want to deal with them. We've done that too with our clients, is, we'll just, do a three-way call and schedule an appointment for them. And then it's kind of in their hands. I mean, obviously they're not going to get as good an application as you would do, but yeah, it's one of those things, and sometimes it takes a long time to build that rapport and trust.
He literally called and said, destroy all the documents I signed.
So I didn't hear the full question, but I think I got the gist of it from what I could hear, and Darla, your response. And I would say, one of the things that, we find is so important, right? You were mentioning this, the rapport piece, Darla, is that engagement. And it's figuring out with the individual, with the veteran, like, what is it that motivates you? And sometimes it might not necessarily be like the benefit. It might not even be the housing for the individual. So like, let's say, working with someone who's living unsheltered, they're outside, resistant to these kind of structured services, but maybe they have a dog, and maybe they need money for dog food and veterinary care, and maybe that's their motivator, and maybe it's like, we can get you both in an apartment if we can get some income. And, you know, there's this program that I think you're eligible for. Why don't we take a shot? And if we take a shot at this, we can get you both inside. You'll have extra income for the things that he needs, you know, his best friend, his, you know, the thing that he's looking for, right? And so that, you know, that's a story sometimes, obviously not a story for everybody, but, you know, what is that motivator? I had one of the first Social Security applications I ever did was someone who, like, I think what I heard was like, does not trust the government, did not want to sign a single form. Well, you know, with Social Security, you've got to sign like 1,000 forms. And he was just very, very hesitant about it and just nervous. And so every time we would meet and we went through every line on every form and we just talked it through. And we're like, so what, you know, what's this going to mean? What's this going to mean? What's this going to mean? And until he was comfortable, okay, fine, I'll sign this one. And he could sign that one. And so, you know, his application took way longer than, you know, it should have or could have, but it was just what he needed and what he needed to get there. And then finally, you know, we got it submitted and he was approved so quickly. But it was just, you know, I was fortunate to be able to invest that amount of time at the time. You know, for some of us who have really high caseloads, you know, spending 20 hours going line by line through forms is just not feasible. But if that's, you know, that luxury, I would say, is there, like, sometimes that's what it takes. Sometimes it's helping someone to see that they have earned this benefit that is owed to them. Like, they served, they are owed this money. And so let's just help get that, because your country owes it to you, and you deserve it. And helping people to see that, you know, can help too. So, you know, there's lots of different ways. It's got to be totally, you know, individualized for the person, you know, what their motivation is and what can really show them that, how this could be helpful. And to get it beyond, to, I guess, sorry, I'm rambling, like, you know, frame it beyond just, you know, this government benefit, but really, what does it mean for you? How does this translate into your life to improve your life or the life of somebody else you care about? Does this money mean that you could see your grandkids? Does this money mean that you could X, Y, Z?
Any other questions or comments?
Well, like I said, I have a comment.
Okay.
As I understand Social Security, very similar with VA, you're presenting an argument to the Social Security Department that you're too disabled to work, whether sedentary or labor. And so, and treatment records, as they're called, in most cases, and again, I deal primarily with VA claims, but they talk about the treatment aspect. So you could have 300 pieces of medical records, and they're talking about treatment and whatnot. And so it's important, I would think, in the same, you know, type of way with VA claims, is when you're there with a doctor, because a lot of times they're, hello there, Mr. Wall, what are you here for? Well, I'm having, you know, I've been having difficulties securing work because of my back and my mental condition, and the doctor's just typing away. Now, is it something specifically that the doctor has came to the realization of? No, but they, and sometimes you have to kind of walk them through what it is that you need, which is evidence. The Social Security Department doesn't know these people from Adam. To be able to create that case where, and I don't know what the burden of proof is, and this may be a kind of a question. Of course, with the VA, it's, you know, beyond, well, you know, 50% of the evidence suggests that the condition was caused by military service. That's what I've dealt with for 10 plus years. But as far as Social Security, is it more or less about the same? Hopefully that was helpful.
get that, Kristen?
Yeah, so, you know, with Social Security, they're not looking at that like percentage certainty. What they're looking at is whether or not there is evidence to show that the condition meets or equals their listing of impairments, which is spelled out. So you can go online and look up SSA's listings and see, you know, how they define the level of disability for different impairments and conditions. So that's what they're looking at. But you're absolutely right that the medical records often don't reference how that illness is impacting the person's functioning, their ability to work. And that's where, you know, we say that SOAR providers come in. But if you're able to get physicians or other treatment providers to add that into the record, it's very valuable because it makes it, rises that information up to the level of medical evidence, which Social Security weighs higher than other collateral information that's coming from someone who's not an acceptable medical provider. Lots of weeds here. But what I'll say is a resource that we have that might be helpful on the SOAR website. It's called Documenting Disability for Medical Providers. And it's basically just a resource that we encourage providers, trained caseworkers to provide to the medical provider that explains disability, explains like what Social Security is looking for, explains how they can help and contribute to documenting the person's disability, which is different than, you know, of course, providing treatment or writing up a medical record and what they have to do for insurance purposes or whatever it is that they're doing. So anyway, that resource, you know, we've got out there because we know that this is a huge kind of gap in knowledge for medical providers sometimes, is understanding, you know, what they need for a disability determination.
Great question. Yeah, let's say Blue Book, which is the listings, you can go in there and it lists, you can click on whatever it is and it'll tell you exactly, you need this, this, and this, and we need, like I'll say, like if there's something like for a hearing, and we need this audiology test to meet this. So it really does just spells it out directly what they need for that evidence. So, and you know, that's a big thing people don't quite get is like, it's not about the diagnosis, and Kristen mentioned that, it's more about the functionality. So you need the diagnosis from an acceptable medical source, but then you also need to see how does that diagnosis affect your ability to function on a daily basis. And then the other thing that's a little bit tricky for Social Security is they look at, you know, are you able to do any work in the national economy? So they're not looking at what's available in Wenatchee, they're looking at could you do any job in the national economy? So that one can get a little tricky sometimes because they come up with some interesting jobs that people need to do. That sorter, that's my thing. You know, so I was like, oh, that might be in some areas, but we don't really have that here. So that sometimes can be a bit of a stumbling block too.
I find that to be a bit of a challenge with myself. I get a lot of referrals from people who say, well, there's something wrong with this guy. He needs Social Security. Okay, well, there's something wrong with all of us, but we're not going to get Social Security. So I get a lot of backlash. Okay, well, this guy clearly has a mental impairment, but he's working 50 hours a week. How is that? My question is, why do you expect me to fill out an application for someone who really is working, who's not impaired by their disability, and who really doesn't want to go through the business anyway? So I get a lot of backlash as a SOAR representative for that. It's pretty challenging. And I think it's because people don't understand how hard it is to get approved for Social Security. It's really hard.
It is.
It takes a lot of work.
And there's a lot of people who are, you know, they learn how to work with their disabilities. So yeah, they may be working 50 hours a week, but are they really able to do that type of work? For example, my sister was one of those people, and she was just, you know, very, very successful, very hardworking, very everything. And she actually was out of work, you know, and I was encouraging her to apply for disability. And she goes, well, I feel better now than I have in a long time. And I said, yeah, and how long has it been since you actually worked? And then I said, and when you were working, you know, how much furlough were you taking? How much time, you know, and how hard was it? And it was very hard for her to come to that, you know, realization that, yeah, she could do it, she could work, but, you know, it was making her worse than better, you know, so sometimes it is, it's hard, and you know, there's a lot of pride involved, especially among people that work is their identity, so it can be difficult for them to come to that realization. Yeah, it's a challenge, and it really does, I mean, you know, in the end,